Hey everyone, my name is Angie. This is going to be my part 2 of the 3-part basically complications after my last immunotherapy. So I will continue with where I left off. So I was discharged from the local hospital on February 27th. So I went home in the evening of the 27th. At this point, I had had 2 blood transfusions and 1 iron, and I wasn't on any new meds or anything like that yet. I was just kind of going off the new blood. So that was keeping perked up. But only for about 12 hours or so, unfortunately. It was like I was a fully charged battery kind of thing, but slowly I would kind of deplete throughout the night. So it wasn't really holding me quite stable. On February 28th, I started to feel really weak again. So I went to the hospital that was an hour away because I kind of knew that at that point I had already tried to go to my local hospital. They did what they could for me there. So I figured, you know what, I'm just going to drive to the local cancer hospital, the one that had Al Blair, the one that had all my doctors from all my chemo and everything. They would have my file, they'd have my history, so they would know what to do maybe a little bit better. So we drove the hour there. So I got to the emergency room. I got an ER bed. I got more blood work. They knew I was a cancer patient, so immediately I was kind of put under my oncologist that was there at the hospital so that she could kind of work on my file. So I wasn't just put off to a random doctor. So eventually I got my own room, and the oncologist quickly attended to my case. So the issue that they were kind of suspecting was my body still wasn't making enough blood on its own. She had booked a bone marrow biopsy to be done in the next day or so. She wanted to investigate that bone marrow because apparently the bone marrow has a lot of secrets and it answers when they're looking at a case like mine, when it didn't make sense why I didn't have enough blood. She wanted to test for autoimmune, leukemia, lymphoma, MDS, and many, many other things. There was talk of a possible bone marrow transplant too, depending on the results. At this point, it was very up in the air. It could have been a multitude of bad stuff. So I was pretty scared, and my friends and family were really quite worried too, because at that point you don't know what the answer could be. It could be pretty dark. So I was given fluids, antibiotics for, I think I must have had a bladder infection too, and I didn't realize that, so I was put on those. I had another blood transfusion on March 2nd. My blood levels had dropped again. My hemoglobin was down to 72, so I got that blood transfusion. And again, thank you to all who donate blood. Without you, people like me wouldn't be making it through situations like this. So I do thank you. At this point, I was feeling pretty scared and kind of just lonely. My husband was coming to see me during the day. He would go home at night, but the nights in the hospital room were kind of worse because, you know, it gets quiet and you're alone with your thoughts, things like that. So I had some tears were shed, and the nurses were very good to come in and check on me and see if I needed to talk. So I do appreciate all of them. They are amazing. March 4th, I had my bone marrow biopsy. They did it right in my hospital room, actually. So I didn't have to go to a OR or anything like that. The doctor came right to me. I was laid down on my stomach on my hospital bed, and I was given an Ativan to calm my nerves, a local freezing in the area to the site. They did it in my lower pelvic bone on the left side. They also gave me some morphine for the pain, which I'm very grateful for. So it wasn't that bad. I've actually had back injuries that were worse. I did feel a little bit of like tapping when he was at the bone and he was taking out, like they take out the core of the bone marrow, I guess. I'm not quite sure of the technical stuff of it, but they basically drilled into my bone and they took out the stuff that they needed with an aspirator, I think, and that was it. The whole thing maybe was like 15 to 20 minutes. I think I had a nurse there with me. My husband was there holding my hand the whole time, but to be honest, I was fine. I didn't feel much, so quite thankful for that. March 5th, I was prescribed 70 milligrams of prednisone. So that is basically so that I'm not needing all of those blood transfusions every, few days. It kind of helps keep my levels up. It's a steroid, keeps my numbers good without having to keep getting so many blood transfusions. So I currently am down to 60 now because I'll get into that later. I do have an official diagnosis and a treatment plan, but prednisone, you're not supposed to be on it very long or very high doses. It does have a lot of side effects. It's a good drug. It does a lot of things for a lot of different things, ailments and stuff, but it can be a little dangerous if you are on it for too long. It keeps you stimulated, so it stimulates your cortisol, the natural hormone in your body responsible for your fight or flight response. So you're always alert. Like I feel very alert and I have like a million thoughts going through my head. I can never relax. I'm very just stimulated. So it causes insomnia in me. So I have to take a sleeping pill like every single night. Like I am so tired all day long, to the point I'm just exhausted, and then I go to bed and I'm just exhausted. But you go lay your head down, but it's just the steroid won't let you get into that like light sleep or REM sleep. It's just, it keeps you going and going. So I do have to take a sleeping pill every night for now. I'm always feeling quite anxious too, so a little irritable. Maybe if you ever talk to my family, I'm getting a little irritable, but I'm trying to kind of keep it on the down low as much as I can. So I was kept monitored in the hospital, the daily doctor visits with any results from the bone marrow, ruling a lot of things out. A lot of things were coming back negative, thankfully. So being that they were coming back negative, they were a little lost on my case. They didn't really have a definitive answer as to what was going on with me. So I was deemed an interesting case, which you never really want to be that. So altogether, I was given 2 blood transfusions at this hospital, and they were still searching for answers. So I was discharged March 8th. I was stable on the prednisone till the bone marrow test had come back with a diagnosis. So I think I will stop there. I'm going to do the part 3, which will be the final part for this. So I thank you guys for joining me, and I will see you in the next video. And don't forget to like and subscribe. Thank you. See you guys.